It was great listening to you. Being a business leader, you brought forward the ideas through the works being done by the ICICI. Well, I must say, if a country fails, the citizens fail too, no matter where they come from, no matter to which strata of the society they belong. Businesses can help foment ideas, put forth those ideas. And that's what we saw in ICICI efforts, talking about two very basic but very important things. You talked about low-cost models, scalable ideas, and partnerships. And thanks, sir, for answering the question, where the private sector comes in. Honorable Minister for State of Corporate, Honorable Minister of State for Corporate Affairs has stated, Shri Sachin Pilot, the Honorable Minister of State for Corporate Affairs, has stated that the new company law has the potential to unleash huge economic and social value. An article in ET read, Companies Bill 2012, How Can India Inc. Made CSR a Game Changer? The idea foments an amalgamation of two different cultures, two different setups. And fortunately, to threadbare this enigma, we have with us Mr. Parul Soni, Executive Director in Ernst & Young Advisory Services and Practice Leader of the Development Advisory Services. He has over 17 years of demonstrative experience in providing strategic leadership for large development programs at country and regional levels with national and international organizations. Sir.
Very difficult task you have given after all our distinguished speakers have already spoken about the whole aspect of better health care and also CSR. But I really want to thank Mr. Upadhyay, John Bleed, and Dr. Chatterjee and Mr. Dasgupta for speaking about the various facets of CSR and also how they are working on these aspects. So I will talk about different other aspects on innovation and partnership, because that is how the whole aspect will be helpful for you. Because when I see our audience, a lot of friends are here in the audience, and I feel really great to see you all, and I really get a lot of energy from you that, from various aspects thought that India will change like this. Because when I started my career, my seniors told me that, this is not the area you should invest in, because I came from a very, what you can say, a good institution, St. Stephen's. So people said, why don't you go and work in the corporate sector? So I said, no, I want to do something different. And that's why I chose to come to the social sector. But it was very disheartening for a lot of senior people to come and say that, there is no career in the development sector. But I think I'm very proud to say that career is what you make out of it. So it's basically, I see bright faces here, all have made career in social development and CSR, and I'm proud of you all. Because that's the moment I really live in, and I get energy from all of you. That's the bright side of CSR or social development, is that you are so committed for your own, not only for your own benefit, to say that you're working for an impact, not looking at your own benefit of how you're living and all that. So I sincerely thank you all for coming here and also participating in this seminar and workshop. And special thanks to NGO Box, because a small initiative from IIFM has created ripple effect. I was telling my team, I said, I can't believe this. This is, when I look at my LinkedIn in the morning, I always see, I think, 10 or 15 pages of NGO Box. And that's what social enterprise is, sir. And if you look at the Schedule 7, the sixth or the seventh point is basically investing in social ventures. I think people like, NGO Box should have special mention to say that, what they have done is you have created history. Because, young professionals like, when I speak to youngsters in Flipkart and Easy Rewards and others. I've incubated some of the social organizations in India and also in Singapore. The whole aspect is when we do mentoring, the whole aspect is how we can invest in the whole capacity development and mentorship of young professionals like, the professionals of NGO work, that they are not only creating awareness about the work, the current trends in the industry, but also they are also creating future for a lot of people who want to come in the industry. So I really thank you and also applaud the way you have been doing this work, and also through social media, you have taken a very positive change in the whole aspect. Now, coming back to the topic which you have given to me is, better healthcare through CSR. I feel that, if you look at the whole spectrum of healthcare, I see that, government is also doing a great work in achieving and trying to achieve the goals. Sometimes what happens is you get really pessimistic approach. You get disheartened with the literature and also looking at the whole aspect of data. But I feel that, government through their 11th and the 12th year plan has brought in a lot of good schemes, like, the National Rural Health Mission, RSBY, and also now the Clinical Act, which is, commendable to see that, this will bring the whole possibility of partnership. When you talk about, ICICI's, the whole journey of what partnership they have created, that partnership says that there is a room for investment, there is a room for innovation, and there is a room for technology to play a bigger role. And that's how the whole schemes have to be. Because when we go to the government and we speak to the government, the whole aspect is we give so much emphasis to say that government has to provide all this. But the whole thinking is government is the biggest provider of services, but it is also on us that, how we should really see that we should help them strive the best, and we should partner with them so that they can provide better services for the people. So this is how I feel is very, very important. And if you look at the statistics on healthcare, I feel, if you look at the food and beverage industry and top industries, if you look at the growth, the healthcare has the maximum growth. If you look at the whole growth pattern, 17%, no other industry will give you so much growth. It's retail and your food and beverage which is giving you growth, and then, the health sector. But this is also gives you a lot of responsibility, that there is not only a demand of innovation, a demand of how investment can be done, but a demand from all our stakeholders to see that how this trend can really change. If there is growth, there is also potential for investment. And if there is investment, there is also to see that, how the social development, because without economic development, there can be no social development. If you look at countries like, Afghanistan and other countries, I've just returned from Afghanistan, that's very, it's coming up again and again, is that, I met the Director General of Private Sector there, and I was trying to see and help him to see that, how can you create private sector investment in Afghanistan? Because everything, from the water you drink, anything you buy is either from Pakistan or somewhere else. So the thinking is that country has to really see that, how investment. And healthcare, coming to healthcare, is when there is a growth pattern, investment has to be done. And that's why it's an attractive destination, and it's attractive for all of us to see that, healthcare will definitely get that maximum benefit. Now coming to, the whole aspect of when there is attractive business opportunity and investment, there is also a tourism opportunity which is coming, If you look at medical tourism, when you visit hospitals like Fortis, Max, and many others, you see so many expats coming from various, countries for treatment. So it is also how the whole treatment and how access to healthcare has increased on that. I will come to, you must be thinking that why I am giving all the story of, hospitals, but I'll come to the partnership and the CSR, because I feel that there is, if we have reached that level, why are we not catering to the poor? That's a big question, because a lot of people will ask that, if we have the best healthcare in the world, when people are coming from, all different other countries, why are we not in a position to cater to our own people? It's because what my friend said is there is so much divide with urban and rural. Doctors don't want to go to the rural India. And if you look at the data which you can get from various sources, our data is quite bad, because if you look at IMR and MMR, we are still lagging behind. We are not doing very well. And people can really say that, yes, we are doing efforts and we are creating awareness. But sir, when Dr. Chatterjee said the impact, I really want to say that, the money we are spending, but impact is very low. Because we are not spending money for impact, the money is spent for either creating awareness, and that awareness is not translating into health-seeking behavior. And that's a behavior we all lack. Today, if anything happens to us, we for 5 or 10 days, we try to see that we take home medicines and don't go to the doctor. Because our psyche is that if we go to the hospital, he will tell us 10 diagnostic tests, and then we will be going around. And the similar situation is happening in the rural India. The situation is worse there because there is no diagnostic clinics. So what we are thinking on various strategies which we have worked with some of our friends, partners of USAID, on triple D approach is say diagnose, this is also diagnostic, and dialysis, small clinics, to see that, these are the main problem. If you look at patients who are really suffering from, renal failures and all those things, dialysis is also a major problem in rural India. So the strategy has to be from a small perspective, from a perspective which can not only cater the urban mass, but also the masses. And it should be like 70% of our people are living in the rural India. We have to see that one approach should be to look after not only urban and rural, to also see that, what kind of, facilities can be for the rural India. Referral transport you spoke about. The thing is that referral transport is it can be really helpful if we can network properly with government and private hospitals together. It's not only that the government hospitals, because government hospitals don't have that kind of infrastructure to cater to. So those are other aspects you can look at. I was also, when I looked at the data and, when we were working on the doctors, if you look at the data on doctors, we are doing pathetic on the data. If you look at the global indicators there, the global indicators are 2.6, but we are at 1.7, which is quite low. If you look at the bed density, we are at 0.67 to 2002 figures. The global average is 2.6, and WHO says 3.5. And that's why we are lacking not only on investment. If you look at Singapore, Canada, and other countries, they're trying to strive that this kind of benefit should be given to the people. Then when you look at the expenditure on healthcare, the GDP, we are spending 4.3% of the GDP on healthcare, which the demand is that, we should spend more money, because not only excess, but quality is also a big problem. So these are things, and then, if you go to the Northeast, you will see the situation is so pathetic and so bad that, I really, or when our team is visiting Northeast and other country, other states, we really feel that, the situation is not on any average. Maybe though that average is not taken into consideration on the national average or the state average. But what is now, how can we improve? What are the things which we can really look at? What will help in the whole possibility if we want to bring change? And my friends, what we need is more collaboration. We don't want competition. We need collaboration. We want you to supplement your efforts. And that effort can be helpful. If you look at our models, which is 11th plan and the 12th 5-year plan, you will see that a lot of emphasis was on PPP, public-private partnerships. But what is the impact on PPP? That's still, it's debatable. It's people are questioning the whole impact that, how this will be helping. When you go to various hospitals, the beds are empty, which are for the, BPL, below poverty line. But the thing is, it's very difficult to negotiate with the hospitals to get those beds. So basically, somewhere we have to be honest enough to say that, that kind of things are. So we also need that kind of activism from you, all of you, to see that, we can create that kind of awareness to say that hospitals should start displaying that. They're displaying, but they're not giving. If you go to a hospital, you will see that they have a nice board, as you have in public schools, to say that so many seats are vacant. But the seats, people are not admitting, or if they're admitting, they're releasing them in the evening. So those are things which we have to really look at. How can partnership can work? How PPPs can work? I can also give an example of Cisco systems. We recently looked at their systems. Basically, what they have done is in Madhya Pradesh and also in Karnataka, they have created clinics through their technology of telepresence. So you can virtually see the doctor, you can talk to the doctor, but the doctor will be sitting somewhere else. And a technology is that your blood pressure, your ECG, your echo, everything is done through technology, and the doctor is monitoring everything. So these are technologies. So one is the people. When you talk about the doctors, the process, what we are talking about, how we have to really look at those processes, and the technology. If we can look at all these three aspects together, then that's a win-win situation for us. So these are things which we feel that, the whole aspect of we can really bridge the gap on CSR. But the money which is coming from the companies, we have to see that the expenditure or the utilization of that money should be impactful. So Dr. Charity spoke about the activities. I will say that, choose those activities, with some kind of impact, or create your own log frame, create your own, key results areas meticulously so that you create an impact. Not that, when you have money, distribute that money into 50 activities, and end of it will be difficult, one, to manage. The second part will be, it will be very difficult to report. And the third part will be, it will not be impactful. So think of those other aspects to say that if you have money, think of creating that impact, and that impact will be helpful on a longer run than to create, just to say that we are all over the place, but we are not creating any impact. So those are things which we have to really look at. I can also cite an example of Intel. What Intel has done is they have invested so much money that they have created a platform for healthcare workers who are basically ANMs at the village level. So what they have done is they have created that platform at their virtual platform, that the ANM worker now carries 9 books, 9 registers. It's humanly not possible for a lady to carry 9 registers. And through the 9 registers, they fill up all registers. Then they go to PHC, then to CHC, and there is no record. And if there are vulnerabilities on maternal and child health and all those things, it will be very, very difficult for a PHC to monitor. So what they have done is they have created the whole aspect to say that everything is digitized. So when you enter, you create a profile, and once you create a profile, as soon as you come in at a zone, through your GPS and Wi-Fi, it connects to your PHC, and the PHC to CHC, and to the district hospital. So the district hospital can monitor if there are vulnerable pregnancies. So the thinking is things are available. What we have to do is we have to connect, we have to collaborate, we have to work together, and see that, that collaboration should be meaningful, that collaboration should be impactful, replicable, scalable. That's the whole story. We own it. So from I, we have to travel to we, and that we will be creating our country. And this money is for nation building, and that nation, we have to really see that, we have to create that great nation, and we are all coming from this nation. So we should be proud of our own country to see that we should work together to create that. So I'm just talking about the whole nation building and all that aspect, but thank you so much. It is great that, we are all here, and let's collaborate, let's work together, and that's what the partnership should be. Thank you so much.